Before we let you go back to your very important work, just wanted to end our conversation with asking you kind of your future vision. Part of being a scientist is being visionary, and you're definitely a visionary man. When you look down the road at things that are coming at the Institute or in the science field in general, what kinds of things are you excited to look at in the future?
Yeah, for sure. I definitely want to, so I'm working on this right now, but establishing a patient-derived sarcoma biobank. This is essentially a living tissue bank here at our institution. We have a wonderful bank of tissue that's already in formalin, but being able to work with cells in the lab, I think, is going to be critical. As I was saying earlier, that we need better preclinical models. There are some established sarcoma cell lines, but some researchers do question the utilization of those and how accurately they reflect the original disease. If they've been passaged over and over and over in a flat plastic petri dish 100 and something times, the cells can change and they may not behave the same. So being able to have the opportunity to acquire patient tissue, whether it's from a biopsy or following a surgery, and take that to the lab and break it down and establish cell lines immediately can be a very powerful tool towards developing better preclinical models. And I have part of my training at the University of Florida, part of my research involvement at the University of Florida was working with three-dimensional cell culture techniques, which offer benefits compared to two-dimensional cell culture techniques because the cells just don't behave the same. In a two-dimensional flat culture, they don't have the same environment with the tumor microenvironment, as it's called. The cells sometimes don't make extracellular matrix for some tumors that do that, like osteosarcoma, for instance. The cells don't have the same intertumoral binding relationships that actually helps drive the cancer, interestingly enough. So I want to begin developing three-dimensional culture techniques here at this institution with the hope that, once we are able to bank a number of different tumor types, that we'll start to have, larger groups, say 5 samples of an osteosarcoma or 6 samples of a synovial sarcoma, and we can start testing with specific medications in the lab and then use that information to guide what sort of clinical trials we develop in the future. So I think that's definitely important. I definitely want to develop more projects with the immune monitoring core here with David Farreau, that we have a very strong immuno-oncology, focus here at Levine Cancer Institute, and right now we're not engaging that a ton in the sarcoma world, and this is true kind of across the world, that just given the rarity of the tumors, we haven't figured out ways to engage the immune system more in fighting a sarcoma. So that's also definitely in my future plans here, is to utilize the wonderful team around me to start to unwind that relationship between the immune system and the sarcoma, and figure out which patients may be candidates for immunotherapy.
You better get busy.
A lot of ideas and ongoing projects. So,
well, all of us at the Paula Takacs Foundation just are so grateful that you chose to land here in Charlotte and bring your just vast knowledge and your expertise to our city and to our institutions here. And we look forward to all the greatness that will continue to come from you and your team. And we just thank you so much for everything you do. As you know, I hail from a sarcoma family, having lost my brother to sarcoma. And so it's not just a professional thing for me, it's a very personal thing for me to meet people like you that are just so passionate about making a difference in a really, really tough cancer that just doesn't get the research dollars in the limelight that it deserves, because, you know, when people get diagnosed with cancer, they don't get to choose. And we just really, really appreciate you, Dr. Anderson.